Hi, my name is Nancy Cronin. I'm the Executive Director of the Maine Developmental Disabilities Council. I'm going to start off this video by talking a little bit about some history. In 1996, Maine closed Pineland. Pineland was its only large institution for people with developmental disabilities. The public had heard about the treatment of people with DD. They heard about the deplorable living conditions and the treatment. Other terrible things happened to people with DD in the name of care. There was a belief that people with developmental disabilities didn't feel pain in the same way as everybody else. Without warning, consent, or patient understanding, people with developmental disabilities were sterilized or even experimented on in the name of science. Media reports on these issues sparked an outcry that led to the dawn of the community inclusion and integration era. The turn of the 21st century brought community programs such as housing, employment, and other supports so that individuals with DD could live in the community. Largely, this recent history was a time that the DD community blossomed, and this was largely due to political will and large budgets. Institutions were considered to be part of the medical model, and the DD community wanted to move far away from that ideology. Perhaps because of this, funding and effort wasn't put into increasing the capacity of medical professionals who served in the community. For example, doctors and nurse programs didn't include information on how to assess and care for individuals who didn't communicate in the same way as their other patients, or even engage in their own health care in the same way as everybody else. As new doctors' offices were built, architects forgot or did not include accessible exam tables and other equipment. I don't believe any of these things were done intentionally, but they were forgotten nonetheless. As the years have gone by, Maine policymakers have included broad expectations of medical practitioners, but in many cases, they didn't tell them they were included and there were expectations of them. What could go wrong with that for either practitioner or patient? Over the last decade, the Maine Developmental Disabilities has worked with doctors and nurses and other medical practitioners to make available trainings and tools to increase their ability in providing medical care for people with developmental disabilities in the community. We've done that through toolkits and curriculums such as When Behaviors Change, Check Pain, how to assess pain in patients who are not or are minimally verbal, diabetes care with an individual with developmental disability, and how to provide care to an individual who has both medical issues as well as mental health issues. This video is geared to increase awareness and mitigate another hurdle in the provision of effective health care: how to help people with DD trust medical practitioners again. In this video, you will hear a story about health care in the institution. After all, 20 years is not that long ago. A story when a patient with DD's symptoms were ignored or brushed off, despite being clearly communicated by the patient herself. And a story about how the system's lack of communication and coordination adversely affects this population in much greater ways than other populations. This video is for you to gain understanding about the baggage that your patients may have experienced engaging in the medical field. And with this information, you will learn what changes that you can make to prevent any further adverse experiences and help heal past injuries. You will also learn the gaps in the system that you alone cannot fix, but you will be able to choose to lend your voice and help us change the system. I really appreciate you taking the time to watch the entire module, and I really appreciate your work. Thank you.